station you count on. This is KARK 4 News at 10 in high definition.
And good evening, and thank you for choosing KARK 4 News at 10, everybody. I'm Bob Clausen.
I'm Jessica Dean. Republican state legislators hosting a town meeting tonight in Faulkner County, talking health care reform and the future. For is Marcy Manley at that town hall. She also spoke with the Democratic Party representatives for their perspective on health care issues. Marcy is covering all the angles tonight. Hey, Marcy.
Hi, Bob. Well, the state legislators at this town hall meeting, which was packed, we might add, don't seem to be in favor of moving forward with the plan in place under the Affordable Health Care Act. And Democrats say Arkansans will be the ones to pay for inaction.
That is why I am inclined at this point to not support it.
State Representative David Meeks opening with a round of applause in Conway, speaking against expanding Medicaid. He and his colleagues say the costs are simply too great.
Yes, the federal government's going to pay for the first 3 years, but our federal government is $16 trillion in debt.
I would like to see us weigh our options with the Medicaid crisis that's looming, $250 to $400 million in underfunding. Right now, I simply think that an expansion of Medicaid in the state of Arkansas is too costly.
But Democrats believe passing up on the expansion will simply send tax dollars to other states and leave some Arkansans in the lurch.
The Medicaid expansion could potentially benefit up to 200 to 250,000 Arkansans, and we need to decide if we're going to take care of our own.
State Senator Jason Rapert suggests waiting until November.
I simply think that right now here in this state, I want to wait and see. You know, if the election results in Romney being elected and a Republican Congress, they're going to repeal Obamacare.
But if it is repealed, Republicans don't seem to have a set plan for what will replace it.
We just need to create jobs, good paying jobs that have health benefits that Arkansans can go and get. You know, we need to look at how we can get communities to step up and put down community clinics for those who may fall into that gap, or even the poor people.
Now, Rapert also suggesting giving states block grants instead of operating the federal health exchange system to give each state local control. But Democrats pointing out that Republican state legislators actually to waive local control when the state passed on operating its own health care exchange. And just to be clear, if Mitt Romney is elected president, repealing the law will still take an act of Congress. Back to you.
Marcy, thanks so much.